You're watching a Verily News program.
Welcome to Verily Wellness Wave, a program where we discuss everything health-related. Today we're talking about something that could save your life. The essential health screenings you absolutely cannot afford to miss at 3 crucial ages: 25, 40, and 60. If you're watching this and thinking, I feel fine, I don't need screenings, stick around, because I'm about to show you why that mindset could be dangerous. Many serious health conditions have no symptoms in their early stages, which is exactly when they're most treatable. So grab a pen and paper, because we're going to cover the specific tests you need, when to get them, and why they matter. Let's start with age 25. You might think you're invincible at this age, but this is actually when you want to establish your health baseline and catch any early issues. So, the first screening we will be looking at is blood pressure screening. You should be getting this checked at least every 2 years if your numbers are normal. High blood pressure is called the silent killer for a reason. It often has no symptoms but can lead to heart disease and stroke. The good news? It's completely preventable and treatable when caught early. 2. Cholesterol panel. Get a complete cholesterol panel, including high-density lipoprotein, HDL, low-density lipoprotein, LDL, and triglycerides. Many doctors recommend starting this at 20, but definitely by 25. High cholesterol can start building up in your arteries decades before you feel anything. This simple blood test could prevent a heart attack down the road. 3. Diabetes screening. Even if you're young and healthy, get screened for diabetes with a fasting blood glucose test or hemoglobin A1C. Type 2 diabetes is becoming more common in younger adults, and catching prediabetes early means you can reverse it through lifestyle changes. 4. Skin cancer screening. Here is one screening people often skip: a full-body skin check by a dermatologist. Melanoma can strike at any age, and it's one of the most common cancers in young adults. Learn to do monthly self-exams and see a dermatologist annually if you have risk factors like fair skin, lots of moles, or a family history. 5. Cervical cancer screening. For women, cervical cancer screening with a pap smear should start by age 21, regardless of sexual activity, and continue every 3 years if results are normal. This test has dramatically reduced cervical cancer deaths. Don't skip it. 6. Sexually transmitted infection testing. If you're sexually active, regular STI testing is crucial. Most STIs have no symptoms, but can cause serious health problems if left untreated. This includes HIV, chlamydia, gonorrhea, syphilis, and others, depending on your risk factors. Now let's move to age 40. This is when your screening game needs to level up significantly. Your body is changing, and risks for serious diseases start climbing. Everything from age 25 plus. You'll continue all the screenings from your 20s, but now we're adding some heavy hitters. 1. Mammogram. For women, this is mammogram time. Most guidelines recommend starting annual mammograms at 40, though some suggest 50. Talk to your doctor about your family history and personal risk factors. Breast cancer caught early has a 99% 5-year survival rate. Caught late, that number drops dramatically. 2. Colonoscopy. Here's the big one everyone dreads but needs: colonoscopy screening for colorectal cancer. The new guidelines move this up to age 45 due to rising rates in younger people. Yes, the prep is unpleasant, but this test can prevent cancer by removing precancerous polyps. It's a lifesaver. 3. Bone density scan. For women, especially those with risk factors like family history, small frame, or early menopause, consider a bone density scan to check for osteoporosis. Preventing fractures later in life starts with knowing your bone health now. 4. Eye exam. Get a comprehensive eye exam, including glaucoma screening. Glaucoma can steal your sight without symptoms, and diabetes-related eye problems become more common as you age. 5. Thyroid function. Add thyroid function tests to your annual blood work. Thyroid problems become more common with age and can affect everything from your energy levels to your heart health. Moving to age 60. By age 60, you're entering the phase where regular screenings become even more critical. The good news is you're probably already in a routine from your 40s and 50s. Many of your existing screenings may need to happen more frequently now. Blood pressure checks might need to be more frequent, especially if you have borderline high readings. Here are a few more screenings to add to the list by age 60. 1. Lung cancer screening. If you're a current or former smoker with a significant smoking history, talk to your doctor about low-dose computed tomography, CT, Screening for lung cancer. This is typically recommended for adults 50 to 80 who have a 20-pack year smoking history. 2. Abdominal aortic aneurysm screening. Men between 65 and 75 who have ever smoked should get a one-time ultrasound screening for abdominal aortic aneurysm. This condition can be fatal if the aneurysm ruptures, but it's completely preventable if caught early. 3. Advanced heart screening. Consider more advanced cardiac testing like calcium scoring or stress tests, especially if you have risk factors for heart disease. Your doctor might recommend an electrocardiogram, EKG, or other heart monitoring. 4. Hearing test. Don't overlook hearing screening. Hearing loss can lead to social isolation and cognitive decline, but it's treatable when caught early. 5. Balance and fall assessment. As fall risk increases with age, some doctors recommend balance assessments and home safety evaluations to prevent dangerous falls. Before we wrap up, here are some crucial reminders. Individual risk matters. These are general guidelines, but your personal and family history matter enormously. If you have a family history of cancer, heart disease, or other conditions, you may need to start screenings earlier or get them more frequently. Make it a habit. Put these screenings in your calendar just like important appointments. Set annual reminders. Your future self will thank you. Listen to your body. Screenings are for when you feel fine. If you notice changes or symptoms, don't wait for your next scheduled screening. See your doctor immediately. I know this seems like a lot, but here's the bottom line. Catching diseases early doesn't just save lives, it saves quality of life. Your health is an investment, not an expense. These screenings might seem inconvenient or scary now, but they're nothing compared to dealing with advanced disease later. So here's my challenge to you. After watching this video, schedule one screening that you've been putting off. Just one. Start there. Your future self is counting on the decisions you make today. And hey, if this video helps you or someone you know, please give it a thumbs up and subscribe for more health content that matters. Remember, taking care of your health isn't selfish, it is necessary. I'll see you in the next video.